Right, well, welcome everyone to, again, our fall 2024 bucket courses. Today, I'm very excited to have a topic which I talked about last time. It has a little bit to do as well. You can dive a little bit further into what Autumn's going to talk about with the exhibition that's here at the library. Really great to have that exhibition here, and please take time to go and take a look at that, either during our break or after we're done here today. So a few quick reminders before we start. Please silence your cell phone. If you have a T-coil, you can turn it on now. We are going to have some questions at the end. We'll bring the microphone around, and so please speak into the microphone so everyone can hear. And then, of course, afterwards, if you can help us clean up, put the chairs on the dollies, that would be much appreciated. So, let's just dive right into this. So today, our talk is from Autumn Wilke, who's the Associate Chief Diversity Officer for Disability Resources at Grinnell College. Autumn is going to give us a talk entitled A Brief History of Disability and Employment in the United States, Understanding Persistent Disparities. So please help me welcome Autumn Wilke.
All right. Hi, everyone. I'm excited to be here. I'm excited to see a fairly full room, which is great. So I am excited to talk about this topic. So what I do in my role as the Associate Chief Diversity Officer at Grinnell College is primarily I support a lot of accommodations for students, but I also work closely with employees, both faculty and staff. And so employment pieces related to disability is something I'm very passionate about and excited to tell people about, because I think there's lots of things that folks just don't realize are still laws that are on the books that make it very difficult for people with disabilities to secure ongoing and lasting employment. And so one of the things that I like to tell folks as I get started with things is that I will have time for questions at the end. I'm also happy to answer if there's something that I can clarify or you have a follow-up question. I'm happy to do that as we're talking. So as I'm presenting about some of the history stuff, if you're like, ooh, can you tell me more about that or what that looked like, I'm happy to answer or provide more examples. If you're thinking it, probably somebody else also has a question, and so happy to answer those as we go along. And I definitely will thank you all to use the microphone when we get to the end. I also use the T-coil. I have hearing aids as well. And so in order for me to hear the questions from you all, that will also be really helpful. So what I'm going to go over today, I'm going to talk a little bit about how disability is defined in the U.S. legally. There's other definitions, but how legally in the U.S. disability is defined. Talk a little bit about what the employment landscape for people with disabilities looks like right now in 2024. I'm going to then kind of switch to talking about how did we get to today? What has happened over the last 150 years in terms of advancements in law and advancements in protections for people with disabilities? And then what are some of the recent things that are happening right now as well related to employment? So really kind of giving a broad scope, starting with where we're at and then trying to explain how we got there. So thinking about disability, defining what disability is. So disability, when I talk about it on campus, it is both a legal protected status, so it has an actual definition under the law. It can also be something that is an identity that people hold. I would say that more and more there are folks where that is a part of what they sort of claim as part of their identity. For example, for myself, a lot of the groups that I'm involved in are with other disabled writers or disabled educators, things like that, where we're able to connect about what it's like working in higher education with a disability, things like that. And so disability is something that I talk about for my personal life quite a bit, not just in terms of the ways that I receive protections under the law, things like that. We're going to really focus on what those legal definitions are today, because that's where the protections for people and how people are defined as disabled or not comes into play. So in terms of how disability is defined in the US, there's actually not a single definition. There are multiple definitions of disability. It depends on what law we're looking at. So the definition under the ADA, or the Americans with Disabilities Act, is that it needs to be something that substantially limits one or more major life activities. And that's a pretty broad and expansive definition. A major life activity can be things like walking, breathing, thinking, So really, really broad categories. And there's not sort of a clear definition of what substantially limits. If you're impacted, you may qualify as somebody with a disability. Similarly, that falls very similar to the definition under Section 504 of the Rehabilitation Act, which is what the exhibit out here is really about, the protests, getting that in place. Where the definition differs is for Social Security income and Social Security disability insurance. They have a much more stringent definition of what constitutes disability or constitutes full disability in order to qualify for benefits. And so it can be this really interesting and tricky thing for people where they might be qualified for accommodations if they're able to secure employment, but not be qualified for benefits and protections if they can't secure employment. And so people can get stuck in this place where they're not able to actually earn an income in either way because of the gap in how disability is defined. When we're looking at some of the numbers, so in terms of what this looks like, so according to the CDC, 70 million adults in the United States meet the definition of disabled. CDC isn't very clear about which definition of disabled they go off of. Based on how they describe it, I think they're using the ADA definition. So not 70 million people would qualify for SSDI, but 70 million people meet the broad definition of substantially impacted in one or more major life activities. In the state of Iowa, 26% of adults are considered to be disabled. So a quarter, 1 in 4 of individuals, adults in Iowa, meet the definition of disability. Women are more likely than men to have something that is a disabling condition, and this is true across all ages. Women are more likely to meet that criteria, and Indigenous and Black adults are more likely to be disabled than those of any other race. And so there's some interesting discrepancies in terms of health outcomes in the US, which could be a whole other presentation talking about health outcomes and who becomes disabled and things like that. But those are just a little bit about what this looks like in terms of scope. So obviously not all adults are in the age of folks who are in the workforce or wanting to be in the workforce, but there's a significant amount of people out of this 70 million who are in what we would consider sort of the workforce age. So what does this mean in terms of types of disabilities? So this is also from the CDC, and what they break it down a little bit differently than some of the other ways that disability gets reported. But what they show is that 13.9% of folks who meet the definition of disability meet that definition under something related to cognition. So serious difficulty with concentrating, remembering, making decisions, things related to the brain most often. 12.2% is mobility. So difficulty with walking, climbing stairs, lifting things, things related to sort of the physical aspects. 7.7%, it's related to independent living, so being able to live alone, do errands independently, a variety of things like that. Hearing, 6% of us are deaf or have a serious difficulty with hearing. 5.5%, it's blindness or serious difficulty with vision. And then 3%, it's difficulty with dressing, bathing, self-care. And people can fall across more than one of these. So people may be disabled across multiple of these categories, depending on what health condition they are diagnosed with. So that's really the scope that we're talking about. In terms of what we're thinking about when I talk about employment, we could be talking about individuals who fall underneath 3 or more of these categories, someone who may require a personal care attendant, somebody who's an interpreter, things like that could be part of what we're talking about with disability. It could also be somebody who is recovering from going through chemo and has brain fog as a result of chemotherapy. Disability can really cover a wide range of conditions and impacts. So what does this mean for employment right now for individuals with disabilities? So in 2024, the most recent data from the US Bureau of Labor Statistics reported that this year, disabled employment is at a record high, which is a good thing and sounds like a very good thing. But they were careful to note that there's still major disparities that exist in employment. So even though we're improving disabled employment over time, there's still some pretty significant gaps, particularly for disabled women and disabled people of color, which from that earlier slide you know are a larger percentage of the people with disabilities. So the current unemployment rate for people with disabilities is actually about 3 times as likely. So people without disabilities are 3 times as likely to be employed as those with disabilities. So the unemployment rate is quite a significant difference between. Only about 20% of disabled women are currently employed, so there's a larger gap in terms between men and women. I think if I remember correctly, for men with disabilities, I think it's about 26% of men. So it's not much greater, but there's still a gap there. And then significant disparities exist when compared by race and ethnicity. So it's a little hard to see because of how light it is on the screen here. But if I use this, so overall, without a disability, the unemployment rate is sitting a little over 3%. I think it's like 3.6 as of this report that came out. If you are white with a disability, the unemployment rate is just under 7%. If you're black with a disability, it's just over 10%. Asian with a disability, just slightly higher than their white counterparts. And then if you're Latinx with a disability, that's sitting just shy of 9%. So there's some interesting discrepancies and significant discrepancies happening there in terms. And again, I don't know if there's been a bucket course about health outcomes in the U.S. and some of the larger wage disparities that happen by region, rural versus urban, the South. There's some really interesting things about where the majority of disabled people live, and it tends to be rural, poorer, more of the South. And so there's some interesting things about the infrastructure of our country as well. So wages. What does this look like for disabled workers? For those disabled workers who are able to secure employment, on average, disabled workers make 66 cents for every dollar earned by somebody who's not disabled. So I think one of the things that we have heard about in the past has been the gender gap in overall pay. There's a significant one for folks with disabilities as well. And so this is of people who are employed. And there's a number of different reasons for this. Some of it is the types of jobs that disabled people are being hired into. Some of it is because of subminimum wage laws that exist. And Iowa is one of the states where there is a subminimum wage law related to disability. So there's 37 states, including Iowa, that permit subminimum wage programs. And what this means is that people with disabilities can be employed into one of these programs and paid significantly less than the current minimum wage. The average across the country for folks in subminimum wage positions is about $3.50 an hour, but some of the positions will actually pay 4 cents or significantly under $1 per hour, which is not going to be a living wage for somebody and or meaningful employment, really. And so one of the things that's really interesting is there's 13 states now that have eliminated subminimum wage programs, and this has been just within the last 5 years that a lot of these states, Vermont is one of the most recent ones, and when you look at those states that have eliminated the subminimum wage programs, disabled employment rates have actually increased. And part of the reason for that, part of the reason that people are speculating that is because the jobs that people are funneled into in these subminimum wage programs aren't actually providing training or ongoing sort of development. They're not things that are going to help people advance into another job. They're not things that are helping people feel more independent or fulfilled in their life. And so a lot of folks don't persist in those jobs. If you don't love your job and you're making 4 cents an hour, it makes sense that you're not really going to persist in that job. Whereas folks who are now being hired into traditional workforce type roles where they're working with coworkers, where they're getting on the job training, where there are positions for advancement, are feeling much more fulfilled in their work and are staying employed for longer. There's also, it's too early to tell, but there's been some interesting studies, particularly in Vermont, also looking at the fact that once they got rid of subminimum wage programs, the number of folks living independently has also increased, probably because people have the financial independence to be able to do that. And so there's a number of ways where the outcomes for people with disabilities are improved when we're looking at equity in employment. So what are some of the barriers? What are the barriers to employment? Discrimination is obviously one of them. We have a number of laws, and I'm going to go through the history of some of those that are intended to prevent discrimination. But there are places and ways where implicit bias or people's beliefs about what disability looks like, or their worry that somebody with a disability is going to be out of the office more often, is going to need more support, it's going to be more expensive to employ. All of those are things that can bias people when they're making a decision between two candidates if they know that one of them is disabled, which is why you're not allowed to ask in interviews or in employment. You're not allowed to ask about disability status, but many disabilities are things, not all, but many are things that would become apparent through an interview process, either because somebody observes your hearing aids or somebody notices how quickly you walk from one location to another, hears a stutter when you're talking. There's a variety of ways where people may make assumptions about the existence of disability, and that influences their decision. So discrimination is one. Another big barrier to employment for a lot of people is inaccessible infrastructure. The US doesn't have a ton of really great accessible public transit. And so for a lot of folks, if you rely on accessible transit in order to get to work or get places for applying for work, if there's not a bus that you can take or get on, you're not going to be able to get to that place of employment. Same for trains, subways, those sorts of things. And while a lot of systems, metro systems and bus systems have been improving, mostly because of lawsuits, we're still pretty slow in that progress in terms of making sure that there's equitable access. Even in the cities where there are a bus or a train that is fully accessible, oftentimes there's significant barriers where you have to plan well in advance in order to be able to arrange for getting on it, having it available, things like that. Oops. This is happening on my computer a lot. So inaccessible infrastructure. The other part is that, and we'll talk about buildings, there's still a number of buildings that are places that people can't effectively get into if they have any form of mobility aid, things like that. So a lot of the laws we're going to talk about in terms of improving buildings have focused on new construction or renovation, but we have a lot of buildings all across the country that haven't been significantly renovated or where accessibility hasn't been looked at in terms of things. And then the last one, which I'll talk about a little bit more later, is that there's actually also some barriers to gainful employment for people because if you're employed, you actually lose some of your other benefits that you rely on in order to live. And so a lot of the protections that come with Medicaid, a lot of the supports that come with Social Security disability insurance are things that you lose if you make above a certain amount, or you lose if you have a certain amount of money saved. And those amounts haven't accounted for inflation over time. So current asset limits for a lot of things is if you have more than $2,000 saved, you lose all of those benefits. And so it effectively means that people can't save money. They can't have money available for if they need to buy a new car, if there's an emergency, if they have health bills. And so it's really easy to lose some of those protections. And for people who require government aid in order to have access to home health care, to a personal care assistant, or other things like that, losing that benefit can be pretty detrimental. There's actually a former student of Grinnell who's now doing policy work. And she wrote a really great article talking about her own experience with losing benefits after she became employed. And not just losing benefits, but having the government tell her that she got a job, so she now owes the government over $150,000 because they believe that she should have to repay the prior. And so there's lots of places where there are these significant and unanticipated barriers that people experience. All right, So how did we get here? What are some of the historical events in disabled history, in disabled employment? As I go through these, you're going to see some trends. You're going to see that we have tried to address some of the same barriers multiple times throughout our country's history. You're going to see that some of the same things have been the impetus for pushing forward for bills related to disability employment. And you're going to see that we kind of keep coming back to some of the same issues over and over. At the very end of the presentation today, I'm actually going to cover a little bit about current bills that are either before the U.S. Congress or the Iowa House, different bills that are designed to try to eliminate some of these barriers that people experience. So some important historical notes before I kind of dive into some of these pieces. Many of the advancements, particularly in the early part of this presentation that I'm going to talk about, they say that they're protections for disabled people. What they mean are disabled white men. That really is the population that was being protected by laws, particularly after the Civil War, World War I, those sorts of things. And so there's a couple places where I will call out where people were explicitly excluded from some of those protections. One of the things that I like to note, because it's an important tension, I think, to recognize, is that many of the advocates for advancement of disabled employment, early people advocating for the advancement of disabled employment, are also people who were instrumental in blocking the vote for women or writing Jim Crow laws. And so it's interesting that people who did a lot for some disabled people were also really crucial in marginalizing other people. And then, as I said before, many of these same issues and barriers are things we keep coming back to. We've revisited them or attempt to address them in a variety of ways. Take a quick drink. So I start with the US Civil War. There's certainly places where individual changes have been made prior to this point, but there's really a lot that began to happen in the late 1800s, worldwide related to disability, but particularly in the US. Just as some context for other things that were happening around this time, the mid to late 1800s is when sign language was really being developed, where Braille printing was coming into play, where a lot of ways of allowing people to communicate with each other were advancing, and where people were beginning to live in settings with people who had very similar experiences to them. So the US Civil War is really seen as one of the big turning points in thinking about employment of people with disabilities. And the reason being because following the Civil War, there were a lot of folks returning home who were missing limbs, who had experienced very significant disabling things during the war. And so the push following the US Civil War really was around how do we help employ these veterans who are returning, particularly how do we employ the white veterans who are returning. A lot of the protections I'm going to talk about explicitly excluded the few number of divisions of folks who were African American, things like that. So there was the creation of the Sanitary Commission, and this was really created to create opportunities for folks to do jobs that were less physically demanding. So this was things like putting together newspapers, selling newspapers. There were a variety of sort of jobs that were being reserved for people with disabilities. This is really, while that was an advancement, it was getting people into employment. This is really where we see the start of some of the building of people with disabilities can do these types of jobs, but not these types of jobs. This is also where we begin to see some of the places where I lost my train of thought. It'll come back to me. There's something else that happened with this creation in terms of the ways that it has shaped our overall history. There were federal mandates to incentivize people to employ injured and disabled veterans. These mandates were things that lasted just for a couple of years following the end of the Civil War. And so there was a spike in terms of people being employed that dropped off pretty quickly once those mandates began to expire. What we did see was the creation of commercial colleges to begin to provide vocational training. This is really where some of the start of the modern vocational rehab programs began to be in play, where it was about providing workplace training for people who were needing to transition to a different career because of disability. This, at the same time, is also where we began to see people being moved into institutions. So this is really one of the places where a greater rise in institutionalization began to happen, and shifting disabled people into some of these roles that would be what are now sub-minimum wage, putting people in congregate living situations, really trying to do a lot of segregation related to individuals with disabilities. That was especially true for folks who had disabilities that were not physical at this point. So people who had what would now be known as PTSD following the war, other forms of mental health related things, often the response was, let's put the person in a mental hospital and not work to employ them. There's really then a gap in terms of big legal advancements between the Civil War and World War I. Right around World War I, we start to see another shift or another push for protections, again because of veterans returning during the war. And so this is where, with the Smith-Sears Act of 1918, the first formal version of voc rehab and employment support services were created, but created just for veterans. So it wasn't created for folks who were disabled and hadn't been veterans, or who were disabled for other reasons. Only veterans returning were protected under this. And it was that first major bill to call out the need for these concerted efforts to support and place people with disabilities who wanted to work into employment. Smith is one of those folks that I wanted to call out, who was a major champion and wrote most of the laws in the early 1900s that protected people with disabilities, but he is also one of the folks who did a lot of the writing and enforcing of what are known as the Jim Crow laws that enforced racial segregation. And so there's some interesting places in some of the early disability law. This is a place where I get really excited. I like reading the early law, but there's places where there's specific carve-outs that say, protects these people but not these people. And that's something that continued to be true throughout all of the major legislation that has happened in terms of disability. There's evidence of that in terms of places where people who were gay or trans were explicitly excluded from the Rehabilitation Act, even if they were disabled. And so there was a carve out. There were places where with the IDEA, which is protections for K through 12 students in schooling, where it was actually part of the impetus and why it passed was to be able to resegregate along racial lines, but call it under disability. And so there's some really interesting places where disability and race have been very much in tension with each other in terms of civil rights throughout our history. Smith-Fess Act, this was 1821, and 1921, not 1821, 1921. And Smith, again, is the same Smith who was involved in the Smith-Sears Act. This established the first federally funded program for civilians with disabilities. So this was for folks who had disabilities and had not been veterans or did not become disabled as a part of the war. This was also known as the National Civilian Voc Rehab Act, and it's the major precursor to the modern voc rehab programs that we have in our states. And what this act did is it provided matching funds to states in order to put in place programs or training opportunities for people to become employed. And so it really was a way for states to secure more money in their state budget by creating programs that were designed to help people get into employment. And at this point in time, I believe this one implemented funds that would last for 5 years. And so this was a short term, again, sort of designed following the return from World War II, or World War I. We see the same thing with World War II. The difference with World War II, you probably are familiar with a lot of like the posters for Rosie the Riveter, or like where there were lots of opportunities for folks to become employed because so much of our workforce, what had been the traditional workforce, was involved in the war. The same was true for people with disabilities. People with disabilities were being hired into roles because of the labor shortage that they previously hadn't been considered for or were excluded from. And so there's actually very much like the Rosie the Riveter posters about like calling women to enter the workforce. There are a bunch of historical ones that are around disability as well, calling people to join the workforce. Some of the protections after World War II were again designed to protect the injured and disabled veterans who were returning after the war. So the Servicemen's Readjustment Act, the GI Bill, which we often think about related to the ways that it provided for education or for loans for home ownership, things like that. It also provided provisions for disability coverage. In prior wars, pensions were really the only way that there was coverage for people following, and this actually began to put in protections and incentivize places to hire people with disabilities, as well as provide greater insurance opportunities and healthcare opportunities following the war. And this is really where we began to see a big expansion of educational opportunities. This is where we saw across the country a lot of technical training programs begin to be put into place, or more community-based colleges. And so really kind of an expansion of higher education happened following World War II. So we now get to be in the period of what I would say is where we began to see more frequent changes happening. Still somewhat spread out, but we began to see things that weren't tied just to war efforts in terms of improvements that were happening for people. And some of these are really tied to forms of disabled activism, which I don't go into a lot in here. I'll mention some of them. But really, a lot of the changes that began to happen in the 50s, 60s, 70s really were pushed for and advocated for by disabled people who were demanding access to things that they were being denied. And in the 50s, one of the things that was proposed was the first national standards for barrier-free buildings. And the impetus for this was that there were all of these benefits happening following World War II, particularly related to education, related to employment. But what was happening is you could get the benefits in order to go for school. You couldn't actually get in the door and so a lot of veterans were talking about like, this benefit doesn't help us because we can't actually get into the buildings because of our mobility devices, because we're now in wheelchairs, things like that. And so this ramp that's pictured here is a ramp a wooden ramp that was installed at the University of Illinois, which was one of the first institutions that began to have buildings that were physically accessible. Other buildings slowly came, or other campuses slowly began to improve buildings over time, but a lot of that sort of stagnated after this bill until there were the protests. Ed Roberts and the Rolling Quads in Berkeley was kind of part of what started to push some of that along. So this established those national standards for what barrier-free buildings were meant to be, how people could get into doors, into the building. And so this was really a reactionary bill in order to start to make some of those benefits that people had been afforded actually achievable. It also paralleled increases in technology that were happening for disabled individuals. So this isn't something law related, but I think it's really interesting to note that behind the ear hearing aids were developed about the same time. This is when we began to see the first motorized wheelchairs being developed in the 50s. And so really expanding some of the ease of access using tools as well came about during this time. So then we get into the Rehabilitation Act of 1973. And I'm going to introduce, I think, the Rehabilitation Act of 1973, and then we might be getting close to a good place for a break, just because it kind of ties in very well to where the exhibit is. So the Rehabilitation Act of 1973 was the first major federal law to address disability rights. And some of the impetus for the Rehabilitation Act of 1973 was advocates and folks saying, what about people with disabilities following the Civil Rights Act of 1963, which provided protections based on gender, race, but did not include disability. And within the Rehabilitation Act, there's several different sections to that. Section 504 is the one that people, I think, are the most familiar with, but sections 501 and 503 prohibited discrimination in employment, particularly employment with federal contractors or federal organizations. And they created the requirement, the initial requirement for making reasonable accommodations for people with disabilities. It also, ITS and I are having a fight. It also created for the first time opportunities or required jobs to be thinking about not just how to hire people with disabilities, but how to retain and promote them. So how do people have advancement opportunities over time? And so sections 501 and 503 were implemented pretty quickly following the Rehabilitation Act of 1973. President Nixon signed it into operation, but initially vetoed section 504. So section 504 was the part of the law that was designed to prohibit discrimination and really parallel those other supports under other protected statuses in the Civil Rights Act. And a big part of the reason for the initial veto was concerns and lobbying around, well, what will be the impact on small businesses? What will this look like for businesses that need to make sure that their diner becomes accessible for people, things like that. And so there were a lot of places where that initial bill was, the 504 section of it, was vetoed and then was eventually signed by President Nixon, but there were a lot of delays in beginning to actually implement the protections. And that's where the Section 504 protests, which is what the exhibit are about. That happened in 1977, so 4 years after the signing of this bill, is really when disabled people began to demand, like, when is this going to happen? When are you going to start to implement these rights that federally have been signed but aren't being implemented at the state level or in any sort of public buildings? And so the protests, which I encourage people to kind of walk around and look at either during the break or after, because the exhibit does a really great job of showing a lot of that activism. It also, something that I learned from our opening of the exhibit when we brought in a speaker, it's the largest, not the longest, continuous nonviolent protest to happen in the United States. So the courthouse in California, Berkeley, was occupied for, I think it was 36 days consecutively. So there were people who did not leave the entire time, which for a lot of the folks was a pretty big endeavor. There was a lot of ways where people were having to support each other because a lot of the folks who were involved in this protest were chair users, folks who had really significant medical care needs. People were helping turn each other to prevent bed sores. There were all sorts of ways where the community was really working together to say, like, where are our rights? We're here. You can't get rid of us. You can't ignore us. And so the 504 protests, I think, are really kind of the major turning point in a lot of both the future legal protections, but also I would say the consciousness of the country or the consciousness of people about people with disabilities, really kind of beginning to think about and recognize this as a large group of individuals who existed within the country. And we'll talk a little bit after the break about the ways that the protesters made themselves very visible, the ways that they worked with other organizations to be really in the forefront of media that was happening at the time, and then how that has continued to be sort of a strategy of disabled activists as they've been pushing for other protections.
All right. Thank you, Autumn. Let's take a 10-minute break, and we'll ring the bell. Barb will. After. Yes, do you have a question? Oh, how long is the exhibit here until the end of this month? Till the end of October. Yeah, good question. Okay. See you in a little bit. All right. I think we're ready. We had some people in the exhibition, so they were listening to. So, yeah. All right. So let's resume second half of this program. And we'll turn off some more lights, too. I've been asked to turn off the front half. Yeah. Hopefully that will help.
Oh, yeah. That makes it.
Okay. All right.
Makes it
Is that
definitely
good?
better.
One more panel. One more? 3. Push 3. Is that better? Yes. Okay. Autumn.
All right.
To you. Thank you.
Perfect. Yes, I can see my screen, no problem. So we're good. As people may have started to see with the exhibit, and I heard somebody ask early on in the break how long the exhibit's here for. It's here for the month of October. If you don't get a chance to see it today, anytime the library is open, it's available for people to wander through and take a look at. And I'm really excited. We're the first location in Iowa to host this exhibit. Definitely excited about that. I know there have been a couple of other institutions around the state who have made plans to try to come see it while it's here. So the 504 protests, what 504 was proposing out of the Rehabilitation Act, the clause was no otherwise qualified individual with a disability in the United States, as defined in Section 504 of the title, shall solely by reason of his or her disability be excluded from participation in, be denied the benefits of, or be subjected to discrimination under any program or activity receiving federal financial assistance. So the Section 504, and this continues to be true, really applies to programs that are either federally connected, so contractors with the federal government, actual like hired through the federal government, or receiving funding from the federal government, which there's quite a few programs that fall into that because of the ways that lots of public programs get grants from the federal government or receive supplements, things like that. And so this is the part of the bill that was initially vetoed by President Nixon, and the regulations had still yet to be published by 1977, even though at that point they had been approved. And so some of the pieces of the Rehabilitation Act, as we talked about before, were being implemented and enforced. Some of the pieces around employment, particularly employment in the federal government, employment with contractors. But very little progress had been made in the broader access and civil rights that were proposed under 504. And some of the things that would have been covered under the 504 part of that would not have been tied to 501, 503 would have been things like access to post offices, access to any government building, access to schools that were providing, that got federal funding or received funding from the government. So really a lot of these things that were pretty instrumental or are pretty instrumental in day-to-day life. Libraries was another part that this began to impact. So really, if you think about any sort of public infrastructure that is in some way subsidized by our government, that's what this part of the bill was about, was providing or requiring that people not be denied benefits of those things. So if all other folks could check out books from the library, people with disabilities were supposed to be able to check out books from the library. If all other folks could come to a program like this, individuals with disabilities were also required to have access or equitable access to a program like this. And so really the 504 protests, and in this picture, Judith Heumann, who passed away just a couple years ago, is one of she's the woman in the front with the No More negotiation sign 504, is one of the big names in sort of the civil rights movement for people with disabilities during the 70s. And I highly recommend, I believe it's free on YouTube. There's a movie called Crip Camp, which is a documentary that came out a few years ago and really covers a lot of the lead up to the Section 504 protests. They cover some of the protests in the movie, but it's really much more about the independent living program and really kind of thinking about some of the building of community for people with disabilities that was happening in the 70s, and highly recommend the documentary. So following the 504 protests, that was 77, there was a little bit of a lull where there wasn't a lot of new sort of efforts happening until in 1983, the Job Accommodation Network was launched. And the Job Accommodation Network is a resource that I probably refer people to on a daily basis in my work. It is a resource that I think super, super highly of. It's askjan.org, and it is a really robust set of resources, not only for employers about how to accommodate people with disabilities, but also for people with disabilities who are seeking employment or are in a job and are wanting to explore accommodations. And so it's a free national project that was launched to share information about workplace accommodations. And I often use it now in like the thinking about what might be supports that would help somebody who maybe has a lifting restriction and is working in a custodial role on campus where they might have to lift or move particularly heavy things. What would be the effective accommodations that we can make through the, sort of purchase of technology or light carts or different things like that that prevent people from having to carry those items. The Job Accommodation Network can really help kind of think through what might be solutions to effectively accommodate somebody. It also includes a lot of resources for individuals about how to request accommodations, how to engage with your employer and negotiate those accommodations. What are your rights as an individual? And so really is a very, very comprehensive resource, and there really isn't another comparable one out there. And so if you have folks in your life, family members, things like that, who are employed and are seeking accommodations, or are not employed but are looking at what would it look like to become employed and have accommodations, the Job Accommodation Network is something I highly, highly recommend as a resource. Their overall goal is to help create more inclusive workplaces by ensuring that workers with disabilities have access to the tools and supports that they need to succeed. And so I would say that the Job Accommodation Network, in its goal of spreading information, was really one of the very early resources that became a very helpful tool for employees with disabilities. When it first launched, it was obviously a phone line. You called in for support. Now it's a website that's very comprehensive and includes blog posts from lawyers, includes a lot of different tools and resources and lists. And so highly, highly recommend the Job Accommodation Network. Yeah. It is government. Yep, it's maintained by the government, and I believe now it is run. I think it's one of the contract type government things where organizations can bid to be the ones who continue to keep it running. Very similar to the ADA centers. So there are a number of ADA centers that provide legal guidance as well, and those are a federal contract. So different organizations are awarded the contract to keep those centers running. And for the most part, it's been the same organizations that have kept these organizations going. The Job Accommodation Network, I believe, was initially hosted, and I think has continued the entire time to be hosted at the University of Virginia. So I think the University of Virginia is who maintains this, but it's a federally funded program and was created as a federal support. The next big advancement was the Americans with Disabilities Act. And so the Americans with Disabilities Act of 1990 is not that long ago. This is something that I often talk with folks about when I'm talking about increases in the number of students who are attending college with disabilities, things like that. We're 35, just shy of 35 years out from the ADA, and that's really not a terribly long amount of time when you think about some of these other protections. So individuals who were protected from the beginning of their life under the ADA are of that age where they may now have school-age children. So really, we're only in the second generation of folks who are experiencing the full benefits of the ADA. And the ADA was designed to legally ban discrimination based on physical or mental disabilities. And this what the ADA expanded on from Section 504 is this applied not just to places receiving federal assistance or federal funding. So the 504 and the Rehabilitation Act was really only those federally funded programs. It didn't touch private businesses. It didn't touch places of other types of public accommodation that didn't receive federal assistance. And so this expanded that all buildings, transportation, communication systems, anything that was available to the public are things that needed to be made accessible or provide reasonable accommodations. And of the ADA, there's 5 titles. So again, like like the Rehabilitation Act, there's multiple sections under it. Title I is what governs employment under the ADA. But you'll remember that there were places where there, in the signing of the Rehabilitation Act, concerns about what sort of impact it would have on small employers. The same was true with the passing of the ADA. So Title I governs employment, but there's an exception for anybody who employs 15 or fewer people. So when you think about a lot of the businesses in a small town, many of those are going to be things where this law doesn't provide protection for individuals with disabilities. But anyone who's a larger employer, has more than 15 employees, is going to be responsible for meeting the requirements of the ADA. And what the ADA, the Title I of ADA does is it says several things. The first is that candidates with disabilities can't be discriminated against at any point in the hiring process. You can't ask about disability pre-employment. You can't inquire about disability as part of the interview process. And once somebody becomes an employee, they are entitled to protections and reasonable accommodations that help them do their work. And so with this, what that means is that if there's somebody who is equally qualified based on education, based on skills, who would require accommodations, that can't be used to screen out candidates. The other part that Title I covers is the provision of reasonable accommodations. And what the ADA says for really all of its titles is that organizations have an obligation to engage in an interactive process to find reasonable accommodations that help somebody do the essential functions or the essential parts of their work. And so what this means, particularly that interactive process part, it means that the decision can't be made without being in consultation with the person with the disability and often their healthcare provider. And so it can't be made just based on your assumptions or perceptions about what a particular disability might look like or what its limitations might be. There has to actually be an interactive process in order to come up with an accommodation that's going to be effective for meeting the needs of the individual. And this is really important because I think there's places where prior to this, and even still continuing after the passage, employers would look at a diagnosis and make assumptions about how that diagnosis was going to impact someone. Whereas 5 people with the same diagnosis, if you take 5 people who now are diagnosed with autism, you're going to have 5 different sets of impact depending on how those individuals experience that. And so in this, you can't just make blanket assumptions about all people with autism can't do this type of job. You have to really assess and look at the skills of the individual. You need to work with the individual on what sorts of supports they feel like would be helpful for them in being employed. And so this was really, I think, one of the big shifts for people when you start looking at unemployment related to disability. Really, we've had an increase in the number of people with disabilities who are employed since 1990, since the ADA passed, because of some of the increases that were put into place as a part of this. Still hasn't closed the gap completely, and we're going to talk about some of the amendments and things that have been trying to help close some of that gap. The other titles of the ADA, just for folks who are interested, Title II applies to public public entities, so this would be like Iowa State University, University of Iowa, things that are state-funded organizations, often education related. Title III is kind of confusing because it says that you have to provide accommodations to anything that is a place of public accommodation. And so it's using like the word accommodation in two different ways. But basically this is anywhere that the public is allowed to go regardless of if it is a private entity or not. So Grinnell College falls under Title III in terms of both the protections we have for visitors to the campus, but also protections for students who are attending the institution. So the next sort of big thing, and this is where I'm going to call the end of the historical stuff, and then we're going to start to move in some of the more recent events. The next really big advancement for people was the Family Medical Leave Act in 1993, which today, and the FMLA has not changed substantially since it was originally passed in 1993, but what it says is that you have 12 weeks of unpaid job-protected leave. And that job-protected leave, there's a number of things that can qualify you for it, one of which is your own significant health condition. And so what this meant is that for individuals who are qualified under the FMLA, if they had to be out for a major surgery, for treatment for cancer, for any number of things, this said that your employer could not fire you. You would have to be put back into your job or an equivalent job when you were able to return from that leave. And this was really important because for a lot of folks with disabilities, particularly disabilities that were episodic or could flare up at various points in time, so a lot of chronic health conditions, things like that. Often what would happen is people would secure a job, but then would lose it at the point when they had to take a leave for treatment or had to step away. And this really says that, yes, employers have the right to replace people if they're gone for a certain amount of time, but that certain amount of time needs to be 12 or more weeks. So really allowing people the opportunity to be substantially sick is sort of a big part of that. It also provided protections for folks who were maybe caregivers for someone else. So FMLA also covered if you had a spouse or a child that had a significant health condition, and so really allowed for a lot of advancements for folks who typically had been excluded or removed from the workforce because of frequent need for medical intervention. And it covers both extended absences. So it can cover for somebody that full 12 weeks all at once. So if somebody is going through chemotherapy and is unable to work while they're going through chemotherapy, they could have the full 12 weeks of protected leave. Many places allow people to use their vacation and sick time in order to still have coverage in terms of pay. And oftentimes short-term disability policies will also come into play and can run parallel. And so oftentimes, even though the FMLA is unpaid, there are ways for employees to continue to receive income during this period of time. But the other thing that it did is it also covered for, and this is where some of the clarifications have happened since 1993. It hasn't changed the original wording, but how people are interpreting it has shifted. It also covers for intermittent forms of leave. And so what this means is that it also provides protection for folks who might have, for example, serious migraines. So if somebody would have previously lost their job because they were missing 2 days a month because of significant migraines or something else that was episodic, provided they had applied for intermittent FMLA, they also were entitled to 12 total weeks over the course of the year of job-protected leave. And so in a lot of ways, this provided supports for folks who had things, again, that impacted you over the course of the year, but may not be sort of one big chunk of time where you were going to be out of work. So what has happened recently? And the last 20 years isn't really the last 30 years, doesn't necessarily constitute recent anymore, but I really think kind of looking at things post the ADA is sort of our look at supports that I would consider to be more recent events, particularly because a lot of the things that I'm going to talk about that happened post the ADA are things that are continuing to clarify the protections of the ADA. This presentation doesn't at all go into court cases and the advancements that have happened because of lawsuits. A lot of the protections for people with disabilities have actually come out of people with disabilities saying, here's my rights. I need somebody to help me uphold them. And so a lot of the supports and laws are things that are retroactive because somebody pushed for it. So the first major thing following the ADA was the Amendments Act of the ADA. So the ADA was passed in 1990, and then there was an Amendments Act signed, and it's interesting because it's the Bushes. The Bushes signed both. So Senior signed the original, GW signed the Amendments Act. So the Amendments Act was really designed, and it came out of some of those court cases where the courts were saying that employers were interpreting the definition of disability too narrowly. So people weren't getting the benefits that they were entitled to because people were saying, well, you don't meet the definition of disabled. You aren't a person with a disability, thus you're not protected. And so really what the Amendments Act did was to help to clarify that disability should be interpreted in a very broad manner. This is where it began to talk about major life activities in more specifics. So in the original ADA, it just said that you had to be substantially limited in one or more major life activities. It didn't say what constituted a major life activity. It didn't say what substantially limited meant. It didn't include any conditions that were almost always going to meet that definition. And so there really wasn't a whole lot of guidance. And because of that, people interpreted it in a very wide range, usually in the way that was most protective for the organization or the employer, not for the employee. And so with this, they listed out a number of things, and they say non-exhaustive. So even the list that they've created for major life activities are things where they say there could be more beyond this. But this really called out specific things: walking, breathing, caring for oneself, thinking, became for the first time something that was defined as a major life activity, which seems pretty important in our day-to-day lives. Learning was called out as something. So if any of those are things that are substantially limited, you could be qualified. It also listed out major bodily functions that it determined to also be. So if you had a substantial impact to your respiratory system, to your cardiac system, to variety of things like that, that also could be something that was defined then as disability. And so really this emphasized that the definition, as I said before, should be construed in favor of broad coverage in order to not limit who is protected under the ADA. And it added a provision that says that it generally shall not require extensive analysis. So one of the other things that was happening pre the Amendments Act for a lot of individuals is they would request accommodations, and then there would be a really long process where they weren't receiving supports because there was, we need more paperwork, we need this information, lots of sort of proving of the aspects of disability, which what that often meant is that in that interim time, people weren't receiving supports, thus weren't performing their job in as effective a way as they could. And so a lot of employers were actually terminating people before finishing the employment accommodation process. And the Act also specified that there may be things that are interim measures that need to be looked at while you're making decisions, and it put parameters that it needs to be, that interactive process needs to be in a reasonable timeline. Still doesn't define it, but at least says that you need to be making forward progress on it, and really says, like, should not be asking for somebody's entire medical history. You shouldn't be going on a hunt for all the things that they might need accommodations on. You should be taking their information and their doctor's information about what they're impacted and how they can be accommodated. 2010 was the next sort of advancement, and this was an executive order. So it wasn't a bill, it was something that was signed directly into effect by the president, and it built on an earlier executive order from the previous presidency. So Executive Order 13163 called for the hiring of 100,000 people with disabilities into the federal government over 5 years. So that was in 2008. We were now 2 years into that call for 100,000 people to be hired into the federal government, and there hadn't been substantial sort of progress on that increase. And so what federal agencies were required to do as a result of Executive Order 13548 is they had to develop specific plans that were to improve the hiring and retention of people with disabilities. So what were federal organizations going to do in order to make it so that people with disabilities could be hired into those roles? This is kind of an interesting one because you can't ask about disability at the point of employment. And so really a lot of what organizations or federal agencies were then focusing on is how do we recruit people with disabilities? How do we get information out about how we are a good workplace for people with disabilities? How are we looking to share information with people with disabilities who are coming out of college? Variety of things like that. And then also looking at how do we retain people who have requested accommodations. And so really kind of looking both at how do we add more and how do we not lose people in that flow. It also required the increased use of Schedule A, which was basically a hiring authority for people with disabilities. So there's an organization that helps federal contractors and federal organizations hire people with disabilities. And so this is one of those places where organizations can recruit from. And so while you can't ask about disability in the employment process, you can partner with an organization that their goal is to get people with disabilities employed. And there's a number of those that exist. And then the order also required that they appoint, that the government appoint a senior level official who's responsible for overseeing this. So rather than just saying we need to do this, they made somebody responsible for making sure that it started to happen. And I have not been able to find whether or not we met that goal of 100,000 people in federal government, but there have not been significant things sort of post that. There continue to be lots of places where you do see about requirements as people are applying to be federal contractors, about making sure that they have a percentage of people with disabilities that are included in their employment roster, having to show that they have a robust way of including people with disabilities, things like that. So the signs point to that this has continued to be an emphasis, but I don't think that there was actually something that was published saying we hit our goal or things like that. Also in 2010 was a new set of building standards. So you'll remember back in the 50s, there was that barrier-free act in terms of making it possible for people to access buildings. The building standards in 2010 set a really broad set of minimum requirements for what buildings had to achieve. And this was really designed to help people begin to meet those requirements that were put in place with the 1990 ADA around buildings that were being renovated or newly constructed having to be accessible. And I really enjoy reading the building standards. This is something that I find really fascinating. And you can find them both in a print version or online. But they go into really significant detail about a very wide range of things. So really expanding people's understanding of what constitutes a barrier in the physical environment beyond just like, can you get in the door? I think there's, I don't know, like 20 some pages just about bathrooms and about all the requirements for what bathrooms need to have. I included one picture here about protruding objects. So there's requirements about how far something can stick out of the wall that someone who couldn't see it might run into, things like that. And so including things about how tall they have to be, how close to the wall, really, really getting very, very granular. And this really is the standard by which new construction is being evaluated against. Some states and some cities have adopted more recent, they've continued to come out with building standards since 2010. The 2010 ones are the minimum that people have to follow, but some cities, I'm trying to remember Grinnell, I think Grinnell might be operating off of the 2014 one last time I looked, which included a couple of substantial changes to the turning radius for things, particularly for wheelchairs and things like that, which was important because the 2010 standards were based off of earlier standards, which only looked at sort of the manual wheelchairs, which tend to be smaller, didn't look at the larger electronic ones. And so some of those updates were really, really important. As you're going around the library, you'll see a lot of the features that are things related to these standards exhibited in spaces like the library, in terms of things that you might not even think about being related to accessibility. But the building standards cover everything all the way through, like how heavy doors can be, how much pressure you need to be able to open them, things like that. In 2017, we've got just a couple more here and then we'll switch into questions. In 2017, there was a final rule about updating Section 501 of the Rehabilitation Act. And this was that there needed to be an affirmative action program created for hiring, placing, and advancing people with disabilities. I have not seen, and I think the courts will eventually address it, whether or not a lot of the challenges to affirmative action on the basis of race apply to some of these things related to disability. They're a different law, and so it's going to be an interesting thing to see how the courts look at disability affirmative action as well. They set specific goals for people with disabilities, including particular disabilities, so that they're in the federal government in particular, X number needed to be individuals who are deaf, X number or percentage needed to be individuals who were low vision, things like that. And then they provided personal assistance services to employees with those specific types of disabilities. And then the most recent thing that has happened is the Retain program was introduced in 2021. It has not been a wide-reaching program. So this was really kind of a pilot program that happened in 5 states, really looking at how do we help workers who have become injured while employed, or who have become disabled while employed, how do we help them stay at or return to work after that injury or illness? And so really kind of looking at the, once a major illness has happened, how do we help you return to the workforce? And so it was a targeted and sort of comprehensive program in these states, looking at how do we create wraparound support with the state workforce development, with local employment service providers, employers, advocacy, and healthcare systems to really think about what are the structures that need to be in place to improve these outcomes. And then the last slide that I have, recent proposed legislation. So there's multiple bills that are currently before Congress, which would raise that asset limit that I talked about in terms of the $2,000 that you can have saved and still qualify for some of these things. It also, I didn't talk about the marriage penalty, but that asset limit also applies if you get married and suddenly your assets get bigger by combining your household. And so a lot of disabled people currently who would love to be married to their partner are not able to get married because it would mean that one or both of them would lose their benefits. There's bills that have been introduced to eliminate subminimum wage at the federal level, and some states have introduced items to reduce that subminimum wage. Iowa doesn't currently have a bill related to subminimum wage, but we have had some in recent years, and I expect that there will be another one that will come up asking the Iowa government to look at, do we keep subminimum wage in the state of Iowa or not? And then there was proposed this last year something called the Work Without Worry bill in Iowa, which would have increased those asset limits specifically in Iowa for people to retain their benefits, as well as provided some additional supports and protections in the state of Iowa for workers. It did not pass this year. I expect that it will probably come up again in future legislative sessions. And so these are just some of the things to be paying attention to. I think a lot of times bills related to disability and employment don't get a whole lot of national attention in terms of knowing that they're even up for debate. So, yeah.
Any questions?
I don't have a question, just a comment. I think it's important when you talk about the ADA to talk about the gentleman who was largely responsible for even making it a bill, and that's Senator Tom Harkin from Iowa. I noticed that in the signing where Junior Bush was signing the bill, Senator Harkin was standing to the right in the blue suit and the red tie. Thank you.
Yeah. The Harkin Institute, which is in Des Moines, is actually, we had a speaker from the Harkin Institute come do the opening for the exhibit for 504 as well. And I think that there are some really important pieces and could do a whole session about the ways that Senator Harkin advocated for a very long time and continues to push policy-related things in both the state and in the country.
Thank you, Autumn. I'm curious. So the captioning seems to work very well. What is the software, and did you have to train it, or is it just something that anybody could use?
Yeah, so it's actually something built into PowerPoint now. PowerPoint has had the capability for a few years. It was not good until recently. Some of the artificial intelligence models have gotten quite a bit better. I'm actually going to pull this off and I'll just show. So there is over here under slideshow, always use subtitles and then subtitle settings. And so you can get them on the bottom top overlaid. And that can be turned on anytime you're using PowerPoint and have an internet connection. You have to have an internet connection for it to work.
Thank you.
Yep. Let me put that back so we can see the captions again. Okay.
Question about the Grinnell post office. Is it accessible?
That is a great question. So, no. There are ways where the post office in town makes it possible for people to use it through other accommodations. Our post office has not been renovated since the 1990s, and thus it's still it's grandfathered into that clause. But the second we make any changes to the building as a city, we will be required to bring it up. And so, like, if the railing breaks off on the stairs, not saying that, it should just magically break off, but if the railing breaks off and we have to do a renovation in order to fix that, everything else with the building would have to also be brought into accessible alignment. The counter is also too high, the service counter and stuff, so there'd be a number of things that would get adjusted.
Okay. Oh. I went to have some work done at Wolf Clinic, and I got this paper, and I could not read any of it. I was supposed to bring it filled in, and I thought, this is ridiculous. It's all this little. And then when we went to look for a good Bible, well, the only way you can get a good Bible is to buy a Pew Bible, or a big one. They don't look at the size of the words. They look at whatever's going to be easy.
Yeah. Yep. Yeah. Lots of, and so there are places, and I can actually potentially put together some resources. So there are places to be able to request large print versions of things still. So the Iowa Council for the Blind also supports folks who have vision loss, and there are ways to get resources. I know we had a student several years ago where we got for them an accessible version of the Bible, both a large print and an audio version. The large print is, you have to have multiple copies, multiple volumes, but they do make them so that they can be read. And so maybe I'll try to share with folks some of those resources that they can post next time or something.
Yeah, that would be great if you could share those resources with me, and we'll make sure we get it out to everyone. That'd be great. All right. Well, please give a round of applause to Autumn. Thank you. Thank you, Autumn, so much. Thank you. And we look forward to seeing everyone next week. Next week is Joe Bagnoli, who's VP of Admissions at Grinnell College, and he's going to come and tell us how he he and staff do what they do. So his title is Grinnell College Admission: Building Success and Shaping the Future. But I think it'll be really interesting for everyone to see what the process is for admissions at Grinnell College, and how many applications they read, and what they look at to then select the students that go to Grinnell College. So please join us next week, and thanks so much, everyone, for being here. Have a great week.